Well, welcome everybody. I have the great pleasure today to talk with another of our speakers at the Ancestral Health Symposium this year. Let me introduce to you Dr. Eric Westman. He's an associate professor at the Madison Duke University, and he's board certified in obesity medicine and internal medicine. And he founded a keto medicine clinic in 2006 after 8 years of clinical research regarding low carbohydrate ketogenic diets. He has written several best-selling books, and he's also co-author of End Your Carb Confusion, a book he wrote together with Amy Berger. He's also co-founder of Adapt Your Life, where he educates people on a healthy low-carb diet. So welcome, Dr. Eric Westman. Nice to have you.
My pleasure to be here, and I'm really excited to be at this upcoming meeting, the Ancestral Health meeting. I have watched the ancestral health movement, so I got into this in 1998 when two of my patients did a diet where they lost 50 pounds, so 20 kilograms on their own. They didn't need me. I was an internal medicine doctor at the time. And like most doctors, I didn't have much training about nutrition or weight loss. And to see a couple of my patients fix themselves, I thought, this must be easy, right? This must be simple. And they didn't even need a doctor to fix their obesity. So back in 1998, I was doing research for clinical trials and FDA approval. And I thought, well, why don't I apply the same kind of thinking to this diet as I do toward drug development? And so we started to do some research about the low carb keto diet. Back then it was called Atkins. And I met Dr. Atkins on a couple occasions before he died in 2003, actually. It's been a while. But so we were surprised to, like, even people today, to me, it's not a surprise anymore because I've been using it for so long. But we were surprised that people actually lost weight by eating more fat. People actually got improvements in so many different things by going against the common teaching. So ancestral health comes along or has been around. I just wasn't aware of them. And that helps me a lot to kind of look in the bigger view of what did humans eat? What are we evolved to eat? And you can learn a lot from that. And I like most experts today, agree with the narrative that the governments got into and companies got into teaching everyone that fat was bad when it's really not, never was. And so now with the perspective of 20 plus years of studying and using a low carb type of diet, and there are lots of ways to do it, I'm here saying it's safe, it's effective, and you should have no concerns about changing the diet so that you reduce sugar. I mean, that's really all we're doing. So if you have concerns, lingering worry about starting or not knowing what the latest research is, that's what I'll be talking about at the meeting. And in the last year and a half, we've kind of shifted, my company has shifted to teach people online. And we've taught thousands of people now over the internet with the method that we learned in large part from Dr. Atkins from 20 years ago. And so what happened is this explosion of internet keto, and I'll be describing what that is, what, the products, the apps, the gadgets and the checking of ketones and all that. And we use none of that because I use a method that my patients were using, 20 years ago. So I'll talk about the differences between what people are learning on the internet that may or may not work, about what a keto diet is. Where do these different influences come from? It's not just the research. There are all these other, not just promoters of products, but there are people who, for example, use a keto diet to make their muscles bigger in the gym. Well, that sort of approach isn't going to work so well for someone trying to lose weight or reverse their diabetes. And so we kind of came up with a survey of all of the people coming through our classes to try to make a distinction between what we know to be true in clinical trials. Now, clinical trials have been done all over the world of low-carb diets, so it's not just our group. We started that 20 years ago with Jeff Volek at Ohio State. He was also doing research at that time, and then Steve Phinney many had done research before that.
Yeah.
But the fascination is what we teach still works. and so if you've learned about a keto diet on the internet, it's not working for you, or you're having side effects, then there might be something that we can fix. Going back to the old kind of, I teach like the old way of doing a low carb diet without all of these add-ons. And I'm really excited to be among a group of international experts. Largely, I speak in the US with a typical crowd of US speakers.
Yeah.
I'm really excited to be with an international group to compare notes, to update each other on the latest research information as well.
Yeah, great. Well, we can't wait to see you there. Well, what do you hope that the audience will learn from your talk?
Well, there will be a review of the science about the low-carb keto diet when used for obesity treatment and diabetes, and even there's some new conditions, well, old conditions that couldn't be fixed by the old paradigm that have been fixed by changing the diet to become a fat-burning machine. It's fascinating. McArdle disease is one of them. And I'll talk about that, kind of the latest, what can we fix using low-carb diets? But then I'll end up with the top 10 differences between the internet keto as taught today with the keto diet, the kind of old low carb, high fat keto, which I know works well for obesity and diabetes. And I hope that if you're stuck or you don't know how to get started or just want to get the update on the science, that I'll be able to give highlights of all three of those things.
Well, that was a nice teaser for people who want to visit the Ancestral Health Symposium in Amsterdam on the 11th of June this year. If they're watching now and they're still interested to get the tickets, I should say, don't wait too long, hurry up, get your tickets now, and you'll get to meet Dr. Eric Westman, but also Amy Berger, Professor Noakes will be there on the screen, not live, unfortunately. We have Gary Taubes, Dr. Ivo Sijpkens, and Professor Frits Muskiet, who will also be talking about metabolic dysfunction and related subjects. So we can't wait to see you there, and well, thank you very much.
My pleasure. I hope to see everyone there.